Okay, what I'm about to say is a little controversial. It might even get me into a little hot water. Anyone who's followed me here for a long time knows that I am typically a good girl, a rule follower, a guideline follower. But I want to share something that isn't an official guideline, but I wish it were. Here it goes. I believe that every woman should have at least one pelvic ultrasound in their 20s. I'm talking a transvaginal ultrasound ideally, and at the very latest in their early 30s. Why? Because I am so tired of being the first person to share with so many women that they have large fibroids or an endometrioma or adenomyosis or a hydrosalpinx, and the list goes on. Sure, some of these issues may have cropped up over time, and maybe an initial scan earlier in life would not have revealed it. But I do think that for so many of the people who I diagnose with these problems, these findings often will explain why they've been feeling the way they've been feeling for a really long time. All too often, pelvic pain, pressure, reduced quality of life, it's normalized. And it's said, okay, this is just what it means to be a woman. Of course, other tests are important, blood tests are important, but they're only half the story. I really know from firsthand experience how imaging the reproductive organs can give such a complete picture of what's going on inside. And you'd be shocked to discover how much can otherwise stay hidden until it's a bigger problem. Like I said, examples are fibroids, even uterine anomalies. People were born with these problems and it was just never picked up. There can be signs of endometriosis that you can see on ultrasound. It's not always going to be able to be diagnosed on an ultrasound, but if it's in the muscle wall of the uterus or in the ovaries, you can diagnose it that way. And the sooner you know, the sooner you can plan around it and also get the appropriate treatment. The truth is, this is not standard across the board. There's a lot of variation, which I think is really unfair. When I talk to some patients, their OBGYNs will do routine pelvic ultrasounds at every annual visit, but some won't offer one unless you clearly state you're having pain, irregularity in your cycle, or trouble conceiving. And sometimes even when patients do have these complaints, they aren't given one. Meanwhile, I see lots of people being blindsided by problems that I'm discovering that have been there for years, just undiagnosed. So this is your PSA. If you've ever had an STI, irregularity in your cycle, painful or heavy cycles, you should absolutely consider asking for a baseline pelvic ultrasound. It's a simple scan that can reveal so much about your reproductive health, and it can help you make informed choices about your future fertility and pregnancy. Have a low threshold to ask your doctor for one. Advocate for yourself. Get the information that you deserve about your body.